How you doing? I'm Dr. Paul Dyer. I'm going to be going over the holistic anatomic system. I've been getting some questions about, when we talk about holistic healing or how can our breath and our actions affect our our bodies. If you didn't know, and I'm not going to go over too much of the science because this is not an anatomy class. Okay, we can go on a different anatomy class later. But as we talking about the autonomic system, it affects everything that we have in our bodies because it runs down. It's all connected through the spinal cord, and I hope you can see this visual pretty good. So as we have our lungs, our heart, our kidneys, our spleen, our stomach, even coming out of our brain and in through our mouth, and it affects everything visually. So let's just go with the science of stress and how we were talking about on a radio show on Bridges, how the body holds trauma and how the body reacts to trauma is because it is flowing through this channel here. When trauma comes in, it is transposed by what? Something that you trigger, something that how your perception. So if you look at the brain, right, and you got the prefrontal cortex, you got the hippocampus, you got the cerebellum, you got the pituitary gland, and you have the amygdala. The amygdala, as you know, is the flight, fright, freeze here, and it's the oldest part of the brain. Now, when we talk about the prefrontal cortex, and then we can split into the hemispheres, and I've talked about the hemispheres between the left brain and the right brain, and how you are perceiving things. So as it comes in here, right, that is just your information. That is how you are gathering things. And in that gather, you are now this right in here, the base of the brain, the pineal gland, that pineal gland which is the melanin and how it receives and absorbs. So that pineal gland comes down. In that pineal gland is now where it comes into your autonomic system. So now, as it comes in here, and this is through your perception and through the trauma, and now things like I said, things can happen to you in trauma that you're taking for granted it doesn't happen. But now, as it comes down here, it is traveling to all the parts of your organs. Okay. Now, we're going to make this a quick education piece because there's always more. So now, as we're talking about energy flow, this energy flow coming from the top, right? It starts right here into the brain, and down here to the spinal column, and then you have down here is called the Kundalini flow, and down the energy flow, and then down. This is where you have the lower Dantian. So as you're circulating this action of flow up and down, you are controlling that action, and that's where the emotional science comes in, because in this it's you have that ability to once you control that flow, because in trauma flow breaks up. Flow does not run like a stream of water going down. When trauma happens, it puts rocks in your system. So it starts putting these little rolls here for oxygen flow. So now we start getting into what your heart is receiving and responding to, what your lungs is reacting to, and how it can filter, and the kidneys and all the body parts. So that's why when we're talking about energy flow and an autonomic system, coming from the brain hemisphere, coming from the prefrontal cortex to the hippocampus and down here to this pineal gland. And then if you could stay away from this amygdala that's going with a lot of reaction, you are able to start the working process of all your organs. There's so much more. I just want to see if you can see this and get a grasp of what we are trying to get you to do, because it starts and there's a flow and there's an action going up and down throughout the body. Well, more to come. I hope you have a beautiful day. Namaste.